Good morning. I felt impressed that I had to go ahead and share just a little bit. I haven't had a chance to really digest this entire article, but I wanted to talk a little bit about Porphyromonas gingivalis, P. gingivalis, and Alzheimer's disease. This article came up upon my radar this morning, and I have a grandfather who passed away from complications from Alzheimer's disease. And so it's been near and dear to my heart, some of the connections that I'm now learning more about and that science and dentistry and medicine are learning more about as it correlates to gum disease and some of the bacteria that cause gum disease that are now being implicated in causing Alzheimer's disease. So like I said, this article popped up on my radar a couple of days ago. I've started to read through it, but I wanted to give you just a real quick introduction about it. So this is from 2019. A lot of really great authors here involved. Totally give them credit and kudos for all the work and effort they put in. This is a very substantial, significantly involved, in-depth review article with some really interesting processes. So I'd encourage all of you who are interested to go ahead and pull this article up. I'll try to put the link in the description here when I upload the video. But read through this. It's very, very interesting. I'll focus on the abstract here. Porphyromonas gingivalis, the key pathogen in chronic periodontitis, their top 5 list, and P. ging is at the top of the list, was identified in the brain of Alzheimer's disease patients. Toxic proteases from the bacterium called gingipanes were also identified in the brain of Alzheimer's patients on levels correlated with tau and ubiquitin pathology. Oral P. ging, this Porphyromonas gingivalis bacteria, infections in mice resulted in brain colonization and increased production of amyloid beta 142, a component of amyloid plaques. Further, gingipanes were neurotoxic in vivo and in vitro, exerting detrimental effects on tau, which is a protein needed for normal neuronal function. To block this neurotoxicity, the authors of this study designed and synthesized small molecule inhibitors targeting gingipanes. Gingipane inhibition reduced the bacterial load of an established P. gingivalis brain infection, blocked amyloid beta 142 production, reduced neuroinflammation, and rescued neurons in the hippocampus. These data suggest that gingipane inhibitors could be valuable for treating P. gingivalis brain colonization and neurodegeneration in Alzheimer's disease. This is amazing. So we're now seeing and this supports this data supports that gingipane inhibitors, these molecules that they designed and synthesized, can actually reduce this neuroinflammation and rescue neurons in the hippocampus, memory neurons. Isn't that interesting? This is amazing to me. As you read through this more, even just in the introduction, you can get a really strong correlative understanding of what's going on, some of the technology or some of the science and some of the processes behind this potential infectious cause of Alzheimer's disease. So there's some potential, and this data suggests that there's a good possibility that infection is causing Alzheimer's disease, or at least contributing to it. So what a fantastic opportunity. Like I said, this is a great study. I'd encourage all of you to read it. It just blows me away now that we're seeing connections between gum disease, bacteria that cause gum disease, that also potentially causes or contributes significantly to Alzheimer's disease through some of these pathways that they discuss here. So I'm going to continue reading through this article. I'll try to give you a little more full review when I get a minute. We're going to be out of town next week on vacation. Not that I'm going to bring any work with me, but I may try to read this article in the evenings after we slow down. But great stuff. Certainly this is an opportunity for us to focus on, or maybe recenter our focus on helping our patients understand why we're measuring all those periodontal pockets and why it's so critical that if they have active periodontitis, that we're recommending the appropriate treatment, which is not a basic cleaning. I've found that as I've begun this more systematic review of some of the articles and information that's out there as it relates to periodontal disease and overall health, I'm armed with more data that I can provide my patients. And being able to have these more informed discussions, even though they're just slightly more informed, but more informed discussions with my patients relative to how this gum infection bacteria can directly correlate not only to your cardiovascular health, but now, Alzheimer's disease, rheumatoid arthritis, all these other issues, all these other connections we're seeing. It helps me to be a better clinician, not just because I know more, but because I can help and I can assist my patient to understand more why it means so much to me. And like I said at the beginning, my grandfather, my mother's father, passed away from complications due to Alzheimer's disease. So this is very near and dear to my heart. All right, so that's my review for the day. Thanks everybody for watching.